There are different classifications of laboratories based on its function, institutional characteristics, ownership, and service capability. So, first is according to function. There are two laboratories under this function: the clinical pathology and anatomic pathology. In clinical pathology, it is related on the sample collected within our body like urine, blood, stool, and other body fluids are tested for diagnosis of the patient. It is considered with the diagnosis and treatment of diseases performed through laboratory testing, while the anatomic pathology evaluates and examines tissue specimens, which include cervical scrapings, biopsies, surgical resections, and whole body evaluations at autopsy. So, next is according to institutional characteristics, the institution-based and the freestanding. Institution-based is a clinical laboratory that operates within the premises or part of an institution such as hospital, school, medical clinic, and others. The most common example of institution-based is hospital-based clinic laboratories, while the freestanding is not part of an establishment institution. The most common is the freestanding outpatient clinic laboratory. Then, according to ownership, it's either government-owned laboratory or privately owned laboratory. Government-owned laboratories are owned wholly or partially by national or local government units. Examples are the clinical and anatomical laboratories of DOH-run government hospitals like the San Lazaro Hospital and the Jose R. Reyes Medical Center, while the privately owned laboratories are owned, established, and operated by an individual or corporation, institutions, associations, or organizations, just like the Hospital of St. Luke's Medical Center and the Makati Medical Center. And lastly is according to service capability. There are 4 categories of a clinical laboratory based on their services, because each category of a laboratory has different services that is able to provide to the patient. The 4 categories are primary, secondary, tertiary, and national reference laboratory. Each category has a different laboratory test to perform, different minimum equipment and space requirement, while the National Reference Laboratory is a laboratory in a government hospital designated by the DOH to provide special diagnostic functions and services for certain diseases. All these 4 categories have different functions and performance depending on its service capability. The laboratory testing cycle encompasses all stages that occur between the time a clinician considers and requests a laboratory test and the time the appropriate patient sample is acquired for testing and the findings are returned to the doctor. So there are 3 phases in this cycle: the pre-analytic, the analytic, and the post-analytic. In pre-analytic phase, this is where you start to decide to perform the test. And then once you decide, the sample is collected. And then after that, the sample is being tested and analyzed in the analytical phase. Then after that, the result will be generated and conveyed to the doctor to interpret the results. Then lastly is the post-analytical phase, where the reading of your clinical laboratory result gives you prognosis and treatment by your doctor. For me, it is very important because you are dealing with the lives of the patient here. You will be the one to assure that your laboratory is giving quality test results because your goal is to provide accurate, reliable, and fast results that are correctly interpreted. This entails that both within and outside the laboratory operations as well as solid laboratory practice and management skills. Clinical chemistry is intended for the testing of blood and other body fluids to quantify essential soluble chemicals, including waste products, useful for the diagnosis of certain diseases. And it is also considered as one of the busiest sections in the laboratory. Then the next section is the blood banking or immunohematology. In this section, blood typing and compatibility testing are the two main activities performed. Screening for all antibodies and identification of antibodies, as well as the blood components used for transfusion, are also conducted in this section. This section is considered as the most critical in the clinical laboratory. Medical technologies are significant members in the healthcare delivery system because they are the one who test the sample and should give us accurate and reliable results because it says that 70% of all medical decision is based on laboratory results. So, as a medical technologist, we should be accurate in our results because that is the basis of the doctor on what is his final diagnosis of the patient. So, if your data is wrong, there is a possibility that the patient's treatment will be wrong and it would endanger his or her life.